Welcome everyone. My name is Julianne Frayne. I'm the Research and Programs Coordinator at the Banff Sport Medicine Foundation. Today I'm joined by Dr. Laurie Hiemstra, who is an orthopaedic surgeon at the Banff Sport Medicine Clinic, as well as a Foundation board member and research director for the Foundation. Dr. Hiemstra was recently named second president-elect of the Canadian Orthopaedic Association, or COA, and will begin her presidency as the first female president in 2022. So congratulations, Dr. Hiemstra. That's really exciting news.
Thank you.
So tell us about the COA and how long have you been a member and what leadership roles have you had with the association?
Sure. Thanks, Julianne, for having me. So the COA is the professional association for orthopedic surgeons in Canada, and it's a nonprofit association that really supports, educates, and advocates for orthopedic surgeons and orthopedic care in Canada. And I've been part of the COA since I started in orthopedics. So they really look to create relationships with residents. You know, right from your first year of residency, you're a member of the COA, and the COA advocates for its resident members as well as its surgeon members. So I've actually been a member since, well, we won't say how long ago that was, but since I was a first year resident. And then as I became a little farther along in practice, I wanted to become more involved. So I talked to actually my mentor, Peter McDonald, and said, you know, I really want to be more involved in the COA. And he put my name forward to be on the membership committee. So I was on that for several years. And when that time finished, probably about 3 years ago, they put out an advertisement looking for a member at large from a community surgeon. Living in Banff now, this is actually considered a community or rural hospital as opposed to a university site. And so I applied to be an executive and board member as a member at large.
What would you say has prepared you for the various leadership roles that you've had in the COA?
Yeah, that's a great question. You know, it's funny, I always thought growing up that there are certain people that were leaders and were so good at it, and other people that just didn't not have those leadership skills. And I've come to learn that leadership is a skill that you have to work at and that you have to learn and grow with. And the best leaders are ones that really work hard at making those skills better. So when I started with the COA, I looked into this a little bit more because I wanted to do the best job I could do. And actually most universities will have leadership courses for their faculty. So I took a couple of leadership courses at the University of Calgary. Funny enough, they were led by an old med school classmate of mine. So I got to have a little reunion there. And honestly, they were really, really good. And I think that those basic leadership courses, which are really just one day long ones, really show you how much you don't know. So, you know, people who think, well, I'm a natural leader, it just comes to me. You know, it's really interesting to take a course and see what's really involved in leadership and know that there's actually a lot more to it underneath. And some of it comes naturally to people, but other things you might want to think about a little bit. So that really got me thinking. And just like everything in medicine, probably the more you know, the more you realize that you actually don't know. So I actually took a course at Harvard. And Harvard has a 3-day intensive course about women in healthcare leadership. And this was lucky for me in the fall, just before COVID shut down. And there was about over 600 women there from across North America and likely some international ones. And it was a 3-day course all about women and leadership and mentorship and how to become a leader in the healthcare world. And it was really an amazing, amazing course. It's led by Dr. Julie Silver, who is fairly famous around North America. And it really changed my life. Like, it really showed me that there's so much out there that you can do to influence the people around you, to influence your local area, your national area, and even internationally. And it really showed me how much work is left to be done. So since then, I've been continuing on that. There's honestly, since COVID hit, everyone's zoomed out probably, but there's a lot of podcasts and webinars all about leadership and women in leadership that are really, really interesting.
So what about your work? I know you do a lot of work in facilitating diversity. What got you interested in the area in the first place, and what kind of maybe some of the key things that you feel that you've learned from working in this area?
Well, that might take more than a short podcast, but
That's right.
it's actually interesting because when I went into orthopedics, I knew there wasn't very many women or girls in orthopedics. And honestly, I was an athlete. I had an awesome mom who just taught me to do what I wanted to do. And I actually didn't pay that much attention to the fact that I was a minority. And I just went along with the normal thought that is, if you work hard and you do what you're supposed to do and you walk in like you belong, most people treat you like you belong. And for me, for a lot of that, that was largely true. It helps that I'm tall. So when I walk in the room, I can look everyone in the eye. But honestly, I went through most of my training just doing it. And when I got onto the executive of the COA, diversity had been on their radar. I was the only woman on the executive at that time. And, they really wanted to push this whole diversity thing as it's becoming more of a prominent thing in the world right now. And they kind of looked at me and said, you're new on the executive, Laura. I guess you're doing this, and you're a girl, so I guess you're doing this. And I'm kind of like, really? And I said, oh, well, okay, this is what you've asked me to do. And I started looking into it, and I started reading more about it. And I actually totally did a 180 flip on my personal feelings on how women have been treated in the workplace, how there is systematic disadvantage for women through our lives, and especially in orthopedics. And that's coming from someone who I think's done fairly well in orthopedics. But there's a lot of subtle things, and there's a lot of systematic things, and maybe a lot of things that I might not have experienced, but other women in the field have experienced. And it was really, really eye-opening to me. So as you know, I've now published several papers on diversity. I'm giving talks on diversity, and it's really become a passion of mine. And it's funny because sometimes the things that you end up doing that are most successful in the world are not things you chose to do, but maybe kind of got handed to you or assigned to you. But it's been really, really fulfilling for me to learn this much. So, yeah.
So just a last question. So now that the announcement was made at the COA meeting not long ago that you are going to be the next president-elect president-elect in 2022, what does the presidency mean to you, particularly in relation to your work in diversity, being the first female president of the association?
Yeah, I can't say there's no pressure being the first woman. There's always that little niggle in there, are people saying, you just got elected because you're a woman, because we have to, get our gender diversity. But I think the work I've done in COA speaks for itself. So I'm not going to go down that rabbit hole. Honestly, I think the COA is a really great organization, and they're a great organization because they are trying and working so hard to be relevant to their members. So, and to come into the newer centuries and address these new issues that are in this world that may not have been around 50 years ago. And there's a lot going on, right? There's gender diversity, there's the racial diversity, there's the Black Lives Matter. Now there's this whole COVID thing, and there's wait lists, and there's lack of jobs in Canada for orthopedic surgeons. Like, there is a lot of anguish in the orthopedic community in Canada right now, and they are trying so hard to take all of that on, and I'm really proud to be part of that. I think there is not a better meaning organization, and it's not a harder working organization for that. So. And I think just as a role model, I don't like to think of myself as that, but we need more women at the table. So if you have a group of like people making all the decisions, they only see their perspective. So if you only have middle-aged white men around a table making all the decisions, even if they are making the best decisions with the best intentions, with every all, hand on their heart for every decision, they're still making decisions that will be good for middle-aged white men because they don't actually know the other perspective. They don't know the perspective of the immigrant or the woman or whatever minority you want to choose. So I think in any organization, you need that diversity at the table. So I hope that me being on that executive and in that president role will show people and other women and minorities that it can be done, and we need to have their input at the table. And I hope it introduces some diversity into the leadership of COA that will be long lasting.
Mm-hmm. Yes, I'm sure it will, and it's you know, we're really excited to for 2022 and to see what things come. So thank you very much for joining us today, Dr. Hiemstra.
Thanks, Julianne.